Alrighty, good afternoon, good evening, team. So this is week two. This is week 2B with the media discussion for NPA 540, Human Resource Management for the Public Sector by Eric Sandoval, and on the 19th of 26. So let's go ahead and dive into it. Alrighty, so a little brief overview. So what we do here is we'll identify an agency and the job position of interest, and then we will informally interview the person that we're hiring. All right. So the position I chose was the agency and the job position. So the one I chose close by to me in the Coachella Valley, I chose a physical assistant surgical services APPs. And so a little bit about the candidate. So, so the name I chose was the candidate was Jackie Chan, and then what made Jackie the ideal candidate? How was the determination of the qualified and unqualified phases and rank amongst candidates? So, so for example, during my interview, I did select a physician assistant in surgical services. And then so essentially kind of like the roles that were involved here is to work closely with surgeons, before, during, and after the surgical procedures. And the physician's assistants in the surgeries, they evaluate patients, develop the treatment plans, order tests, and provide post-operative care. They're an important part of the surgical team because they help improve patient outcomes and ensure continuity of care. So, as I mentioned, we interviewed Jackie Chan during this interview. So, so um, so essentially, what during this interview, this candidate, we can say, and shared information about their daily responsibilities, and about the hiring process and what employers look for when selecting candidates. And essentially, their experience gave us a better understanding of how healthcare organizations recruit, hire qualified physician assistants. So we did the so we did select this person, and why did we choose this person? Um, because uh, because we're interested in the healthcare careers, right? So especially surgical medicine. This individual wanted to learn more about the education, experience, and the hiring process for this profession for someone who currently works in the field. Their firsthand experience provided valuable insight into what it takes to essentially be a successful surgical physician's assistant. So a little bit about the qualified and unqualified. So during our initial phase, the employers review applications to determine whether these applicants meet the minimum qualifications. So for these qualifications as a surgical physician assistant, it's to include the graduation from an accredited physician assistant program, to have certain certifications, a valid state license, and a lot more. To ensure that we want to ensure that they have relevant education, clinical rotation, surgical experience, and a lot more. And being able to rank the candidates, then that could come in our second phase, third phase, in our second phase. So essentially, here in this section, employers compare qualified candidates. So we use several factors, such as surgical experience is highly valued, especially experience assisting in the operating room, interview performance, clinical skills, communication abilities, letters of recommendation, previous work experience, and a lot more. And then now, during the interview process, the interview process usually kind of includes a behavioral and situational interview questions, about how they handle emergencies, difficult patients, collaborate with other surgeons and nurses. Because essentially, being in a hospital, we have a structured interviews. So we want to be able to kind of measure and be also, but ensure fairness and consistency, right? And then, and oops. And then we go. All right. And then so during the 10 interview consideration questions, we want to have several important interview considerations are used during the hiring process. So essentially, we can ask for job related questions using consistent interview formats. We want to avoid discrimination and bias, take detailed notes, assess teamwork, and ask behavioral questions as well. So, and and then furthermore, in structured versus unstructured, determination for best candidates in phases 3 and 4, selecting the best candidates. So we will during this section, hiring managers compare all the information collected throughout the hiring process. They consider interview scores, qualifications, surgical experience, um, how well each candidate fits the organization's culture. Reference checks are completed by contacting former supervisors as well if needed. And then for confirmations from phase 4, before the candidates begin, we're going to have several confirmations that are needed to be met. Those can include verifying their N double CPA certifications, employment history, criminal background, drug screening, immunization records, credentialing, hospital privileges, and a lot more. And then, and essentially, and during this, these type of interviews will help us better understand the hiring process for those for those surgical physician assistants. And what we need to keep in mind that employers look for candidates who have the right education, certification, and clinical experience. And thank you all.